And we're back with another episode of On the Record with Tiffany. And today, I'm here with Dr. Stacy Speedlin Gonzalez. Um, Dr. Gonzalez, can you tell us a little bit about what you're doing to assist our community?
Thank you. So Judge Rosie mentioned to you earlier about our House bill. She mentioned a lot of the work that we've been doing together. I'll give you a little bit of background on me before I respond to the question, if that's okay.
Yes, please do.
Okay, so I have a Ph.D. in counselor education and supervision. I'm a licensed professional counselor. I'm also a licensed chemical dependency counselor, and I am board certified. The relevance of all of that is to say that I've been working with clients with substance use disorders for a majority of my career. And why that's noteworthy is I don't just work with clients with substance use disorders. I work with clients who are really treating bigger conditions with substance use disorders. And so by the time they come to me, generally speaking, there's a lot going on in their lives. They're not just coming to me because they woke up one day and decided they wanted to stop drinking or stop using substances. They come to me because there's trouble. There's external factors that are going on in their lives, usually criminal justice involvement. Sometimes it's more civil, such as divorce, custody battles. They're losing their children. Maybe there's a lawsuit involved. Maybe they're losing their job, but something is going on that leads them to seeking my services, which is what I've done for a while.
There's a catalyst that causes them to call you.
That's right, a precipitating event, if you will. And so I have a small private practice here in Bexar County. I'm actually, my practice is titled Luz Counseling and Consulting. I do some clinical work. I also do some consulting work where substance use is involved. And I'll talk about that a little later, but I'm also an assistant professor in practice at the University of Texas at San Antonio. So I teach licensed clinicians. I actually was originally hired to teach the addiction class and the crisis, grief, and trauma class. So that is my specialty. That's a lot of the work that I do clinically and educationally.
What caused you to go into that specialty? Was there something along the way that you thought, this is where I belong. This is what I want to do?
That's a great question.
You've put so much of yourself into this.
It's a great question. I actually sobered up at 25 years old. I'm 44 now, so you don't have to do the math. I've been clean and sober for 18 years. I understand addiction more than I'd like to. Wow. I have my own experience and my own journey. And when I got sober, there was a lot going on in my life. So, yeah.
So you have the patience and the empathy for what's going on here.
I understand the courage that it takes to get sober. I understand that just like domestic violence, if you've never experienced it, there's no way I can explain it to you. Addiction is the same way. Until you experience the powerlessness of addiction, there is no way that I can explain why someone makes the choices that they make that can be frightening to the people that love them.
The drive that you and Judge Gonzalez have for this, the fact that you wrote legislation, that you just kept pushing, even when it felt like this isn't gonna work out. Y'all just redirected efforts and just kept going and kept going. That kind of drive generally comes from a personal connection to something. Some sort of catalyst in your own life and heart where I have to see this through. Because if I don't know that anybody else is going to have the determination to see it through.
If I can be frank, it's not just a matter of experiencing things in our past. We also have to have healed from our past, because what we do not heal persists and manifests in unhealthy ways in our professional work. If I had not done the healing and the self-forgiveness, then I wouldn't be able to work with people. And believe it or not, there are people who are survivors of whether addiction, domestic violence, or any problem in this community that do not like the people they work with. Because we experience countertransference. Whatever I haven't healed is going to come and sit in my office. That's the way the universe works. So yeah, it's important that I did my own healing. And part of that healing for me, part of that awakening, and I believe Judge is consistent on this matter as well, is to be able to understand that there is no us and them in this community. Right? We are all struggling with trauma. We all have our history. We all have our idiosyncrasies. And how do we help a community heal? The solution is not always incarceration. It matters at times. But we need to be more consistent about looking at where is the precipitating event that led the person to the court system. Because otherwise, if it is substance related, then jail is insufficient. It's going to give them a timeout. They'll come back out. Nothing has changed. And we see those high recidivism rates. In my work, I mean, I see people who relapse and remit all the time with substance problems. And it's easy to blame the person. It's easy to say you didn't do what you needed to, or you obviously don't love your family, or you obviously don't care. Until someone is there to really be patient with us and help us and empower us to do that courageous internal work, which is not easy, then what are we going to do but continue on with the status quo in this community, which is very high numbers of child abuse, domestic violence, and addiction. We are one of the top counties of all three issues.
One of the things that I like about your program is that it is empowering people. It's giving them the tools to do the work. Whereas in the past, like I was saying to Judge Gonzalez, it really, when she said that the women wanted the system to help them fix the men, and that she was like, okay, let's do that. That really made me realize, that I had an intolerant stance on this, because my first instinct was no, absolutely not. With the men, as a woman, you're like, I don't think so. But as soon as I took a breath and listened to what she had to say further, I was like, she's right. Because the women that are going through this, they do love those men. They're going back, and the men that are going through it, they love their spouses, and they're going back, and they're going back, and they're going back because they love them. So at some point, figuring out what is the impetus that's causing the abuser to be an abuser is a very logical question to ask.
Yeah.
It's just one that we don't want to ask. Often we don't want to ask that question. We just want to lock them up and throw away the key.
Yeah.
But that's never the answer. That's never the answer, because it will never stop the problem that we're experiencing.
Right. And please know, there are times where people need incarceration, where they are just not safe, where they will not respond to therapeutic interventions. And the safest thing for the community is for them to be incarcerated. And we recognize that that exists as well. But if all you have is a hammer, then everything starts to look like a nail. If that is the solution for every problem, and when we talk about family violence, we oftentimes want to focus on spousal battery. We don't look at a good percentage of the cases that come into Judge Rosie's court, which are family members who have an adult child who is living in the home with a mental illness or a substance problem. There's nowhere else for this kiddo to go. Culturally, they don't abandon their young. So they got this 22, 23-year-old son or daughter who's living there gets off their medication, starts abusing drugs, attacks their parent. The parent calls the police, and then the police arrest this individual, and you see the families crying because that's not what they wanted. I just wanted you to come over and talk to him. Can you just talk to him and tell him to take his medicine? He's a good boy. You know, when he gets off the alcohol, he's a wonderful kid. You know, let me show you pictures of his football, you know, his football days. I mean, we're talking about this would be my son. This could be anybody's child who is just down and out. And we're hoping that the system can help us. But it gets to a point where if families know that the only solution is going to be weekends in jail, they stop calling.
Yeah.
Right. We're just going to handle it in-house. Next time he hits me, I'm going to call his uncle to come over here and hit him. And now we've got a cycle of abuse that has become normalized. Families are taking matters into their own hands.
So what do you do? What are you all experiencing in terms of data outcomes with the program? What are there some success stories coming out of this? Like, how are you?
There are some success stories, but one of the things that we really wanted to focus on, because we've done a lot of the research looking at the drug court, you know, looking at not only the 10 key components, but a lot of the fidelity measures with drug court. It's very important that when cases are screened and considered for participation in a drug court, that they are considered higher risk cases. The reason why, we don't want to throw a lot of county resources at someone who would have done fine on probation.
Yeah.
Right. Or would have done fine with a dismissal. So a lot of the cases that are coming in, a majority of the cases have been, well, they've all been screened, but a good percentage of them are very complicated.
So you're putting the resources towards the tough cases.
Oh, absolutely. Yeah. Because that's what it's intended for. This is intended to not only be cost effective for the county, but to provide the optimal level of accountability. Because if that level of accountability is not necessary, there are other methods that judge can use, more traditional. So the cases are challenging and they require a lot of consistency, and judge has to remain patient with them. Judge has to develop rapport with them. What makes that challenging is obviously a lot of people who have had experiences with the court system do not see the court system as an ally.
Yeah.
So
you have a lot of obstacles that you're trying to overcome in one case, in any given case that you're dealing with. You know, because there is a definite fear of the authorities in a lot of minority communities.
Yes.
So when something like domestic violence comes up and you already know that you've done something wrong, you know, how do you get people to accept the help that you're giving, that you're offering?
It begins with developing and mentoring a great team. And Judge Rosie has that. We don't talk enough about the key element to the success of drug courts being a strong team that can look past the pathology or the crime, if you will, and see the human being and be patient with them and be understanding that people who have substance use disorders are accustomed to not telling the truth because they've had enough lectures, because they've been pulled over enough times. How many of you had? 2, I mean, they've become accustomed to how they interact with people. So the idea that they can acclimate to therapeutic environments or any kind of atmosphere alternative to punitive or incarceration, it is a transition for them. And to be able to understand that and to work with them and recognize the survival instincts of this population, which is lying, which is not telling the truth, which is a lot of times they change on the outside rather than the inside. They become that model patient. They say all the right things, but they're not making the internal change that's necessary, right? Being able to challenge that, being able to recognize that, having that strong clinical skill matched with the empathy and compassion for the courage that it takes, because they could have sat it out in jail. 1 year of jail. A lot of my clients will do that over this, because at least in jail I can be loaded.
And, I like this specialty program because, and I like what you're saying, because I think sometimes people don't realize just how much work goes into getting your life together again after having gone through something like this.
Yeah.
It is work for the individual, it's work for the whole family. It's not something that can be accomplished in 90 days.
Mm-mm.
You
And
know,
there are external factors that will come up against it. There are family members that will normalize their behavior. They have, they have friends that all use drugs. And it's like we're asking someone to change their entire life just to survive and do this program. And the thing that I'm not even talking about yet is what happens when people who have an actual addiction stop drinking and stop drugging, how hard that is to be sober.
mhm. I mean, it's the fact that the two of you thought through and gathered a team to think through all of the aspects of this. That's, I thank you for doing that for our community, because this was a major undertaking, trying to create a real path, a real sincere path back to life, and to a life that the individual wants, to their dreams. This is a pathway back to their dreams and their goals in life before substance abuse came in. That is a difficult and time consuming journey, just to think of what the path could be or how to get them back to it. And then trying to build the bridge in terms of relationships with the person and build some trust. That is a very commendable thing for you all to do.
I appreciate it. And I appreciate you giving us the platform to speak about it. I realize that sometimes it can be challenging in our community when we talk about this topic. It is such a hot button topic, and the idea of working with offenders is, I would imagine, is challenging for a lot of people to conceptualize. It almost sounds like we feel sorry for them, and we, want to let them off the hook, and that they should somehow not receive any kind of punishment. And yet our real aim is to create permanency of change as opposed to a temporary solution.
And the goal always with any sort of penal system is to help the person or the perpetrator, or however we're describing this, to help the individual become a productive member of society. If the goal is always to help the individual become a productive member of society, then that means you have to do the work to become a productive member of society. You have to have the tools to do the work to become a productive member of society. And sometimes that's a lot of work on the opposite end for professionals like you, because 20 years ago, those specialty courts, according to Judge Gonzalez, were completely different from the iteration you all have created in the specialty courts.
Yep. And it really came from the birth of the over-incarceration of people with substance problems. And they said somebody stepped in Miami. There was a judge in Miami that decided that rather than incarcerate them, can't we offer them therapeutic services, clinical services, to render them sober so that they don't keep coming through our system. And it was a novel idea. It was actually attempting to resolve the problem as opposed to, just follow the letter of the law.
Yeah.
Following the letter of the law, which is, the letter of the law has its purpose. We don't deny that, but we have to really look at individuals, because at the end of the day, and that's always been my challenge in any situation, whether it's in the judicial system, whether it's in the clinical world, we don't always get to see how the decisions that we make impact the individual in the long run. There's no accountability there. You know, if I were a judge and I was a civil judge and someone came in and needed a protective order and I denied that, what are the odds that they're ever going to come back and tell me what happened because of what I did? We don't know that. It takes so much careful consideration. And, you know, therapeutic jurisprudence, which Judge Rosie talked about briefly, you know, this idea, this concept of therapeutic jurisprudence is where, you know, the judicial community and the therapeutic community come together, because we should work collaboratively. We're working with the same people. We're not adversaries. You know, we have a different lens, and both are so relevant and important to the lives of individuals, because my community, my clinical community, cannot affect change, whereas the judicial community does, and vice versa. You know, it's a different exchange of experiences when working with the same individuals. And so therapeutic jurisprudence is a way, it's a lens, if you will, of looking at individuals who have a persistent problem in our community. And every year, billions of dollars are allocated towards the research and intervention of substance use disorders. And please know, we have not cornered the market in that problem. We are light years away from resolving that issue in our communities. And yet every year we are confronted with new problems. The drugs are harder, they are faster, they are killing people younger, they are far reaching, and every community is affected. And sadly, it took certain communities to get affected before they finally looked at the issue and said, my gosh, let's create a crisis. Let's determine this to be a crisis. But this is not new.
It's been a crisis for a long time, but often with crises in this nation and everywhere else, people don't notice it until it is overwhelming the majority. When it's just a small group of people or one segment, one demographic, nobody's really paying any attention to it. But when it begins to take over the mainstream, then all of a sudden people can see they can see the humanity in it more than they could before. Because crack cocaine is a very good example of that. Now that when crack cocaine came out, there were all kinds of punitive initiatives in regards to that. Whereas with methamphetamines, people see that as something that needs to be treated in a rehab center, and our children are being accosted and given a drug that they shouldn't be taking. And I certainly agree with all of that. I agree with that our children are being accosted, but I think that we should see that at the onset when drugs take over any community. Any community, that's a place where we got to nip that stuff in the bud from the beginning, you know. And I love that you all are thinking about this and have put together a program that at least gives them a shot. It gives them a shot at walking back into life again and into being a part of their family unit again. You know, you've been listening to On the Record with Tiffany with Dr. Stacy Speedlin Gonzalez. And this lady is a hero and a warrior in our community for mental health, for substance abuse, and for a new pathway back to life. And I thank you for everything that you're doing for the people of San Antonio, Texas, and Bexar County. And I look forward to seeing what you're going to do next.
Thank you.
And you guys have been listening to On the Record with Tiffany on 9:30 a.m. The Answer, and on the African American Network, where we have a local feel and a global reach. Come back and visit with us next week.